Objectives of the presentation video: to explain in the fundamental concepts of mechanical and the electromagnetic waves in the medical context, to describe how waves involved in the physical function such as hearing, voice production, and nerve signal transmission, to illustrate to go dramatizations, everyday and clinical examples where waves play a role in the human body, to relate the physical principles of wave to medical technologies such as ultrasounds, to analyze the benefit of physical node in medical practice and the proper use of diagnostic tools, demonstrate the application of physical exercise, the enforce the understanding of wave phenomena in medicine, to evaluate the importance of comprehensive medical education that includes physical and technological functions, to stimulate scientific curiosity about the improvement and innovation of ways medical technologies.
The importance of wave biophysics in medicine. First, waves are essential for multiple physiological functions. For example, mechanical waves are present in the propagation of nerve impulse, the vibration of the vocal cord, or the transmission of sound through the mere air. Electromagnetic waves, on the other hand, the base for the functioning of diagnostic imaging techniques such as magnetic resonance imaging, computed tomography, ultrasound radiography, or nuclear medicine. Waves show the stopping because improvise as an educational and professional approach going deeper into desire, favor and markon, hygiene and technological competence medical trainings, allowing the future health professional not only to use technology but also to understand them and participate in their improvement or innovation.
Wave theory from the perspective of classical physics. Waves are defined as disturbances that propagate sound and medium transferring energy with sound transferring matter. This propagation may occur in physical media, such as solid, liquid, or gases, or in the vacuum in the case of electromagnetic waves. Classification of waves. From a physical standpoint, waves can be classified according to Bacchedian criteria. 1. According to the medium of propagation. Mechanic waves require a material medium to propagate. Examples include sound waves and waves in strength. Electromagnetic waves do not require a material medium and can propagate through a vacuum. These include light, X-ray, microwaves, among others. 2. According to the direction of vibration relative to the direction of propagation. Transversal waves, the disturbance is perpendicular to the direction of propagation. Longitudinal waves, the disturbance is parallel to the direction of propagation. 3. According to the periodicity. Periodic waves repeat at regular intervals are characterized by their frequency, variably low period and amplitude. Aperiodic waves or pulses are transient in nature such as signs street in a rope. Fundamental parameters. 1. A wavelength the distance between two sequences, the creds or thongs. 2. Frequency, the number of cycles per second measured in hertz. 3. Wave speed, relative to frequency and wavelength shown by the equation wave speed is equal frequency by wavelength. 4. Amplitude, the maximum distance from the equilibrium position is the direct relative to the energy carried by the wave. Wave phenomena. Wave theory characterizes wave structures as 1. Reflection, the character is direction when a wave encounters a boundary. 2. Refraction, the character is direction as a wave passes from a medium to another. 3. Diffraction, the bending of waves, then they encounter obstacles of apertures. 4. Interlaces, the superposition of two or more waves, this which may be controlled or destroyed. And finally, conclusion, wave theory is a fundamental pillar of physics with a broad application ranging from a course to optics and medical diagnostic. In the success, its study provides essential insights into the transmissions of the energy across diverse physical and biological contexts.
The case of Ana Maria Lopez, a 32-year-old pregnant woman with a gestational age of 22 weeks and 3 days, is present. She attended a routine prenatal check-up with no relevant pathological history or complications in the current pregnancy, which is proceeding in a physiological manner. The maternal physical examination showed vital signs within normal parameters. BP 110 per 70 mmHg, HR 82 BPM, concordance uterine height 21 centimeters, and perception of active fetal movement. No clinical signs of labor were identified. As a part of the obstetric follow-up second trimester, morphological ultrasounds was performed. This technique is based on the emission of high-frequency mechanical waves that pass through soft tissue at an average speed of 1,540 meters per second, generating image by differential reflection of these waves at interface of different acoustic impediments. A 4 MHz transducer was used, suitable for achievement a balance between resolution and penetrance at this gestation stage. In conclusion, we can say the integration of biophysics principle of ultrasound and its correct clinical application allowed a comprehensive assessment of fetal well-being, highlighting the relevance of physical acoustic knowledge in the contemporary obstetric practice.
Hello everyone, today we are going to present an exercise about measuring the frequency of an ultrasound in human tissue. Okay, here we have the statement that we are going to use that is about, I am going to read the statement. An ultrasound emits longitudinal mechanical waves that propagate in soft tissue at a speed of 1,540 meters per second. If the wavelength recorded on the ultrasound machine is 0.5 millimeters. Okay, this is our statement, and here we have the data that we need to do the exercise. This is about propagation velocity and the wavelength. The velocity is 1,540 meters per second, and the wavelength is 0.5 millimeters. In this 0.5 millimeters, we have to convert to meters, and the result is 0.0005 meters, because we have this velocity, and this velocity has in the equation we have to cancel the meters, and we have here meters with meters. Now we now have the frequency, and this is, we have to change the frequency that with the data, and this is our result. But in this case, we need to convert this result that is megahertz with megahertz, and is 1 million hertz. We have to change this 1 million hertz for 100 hertz. That is this one, 3.08 hertz. And this is all our equation. Bye!
Conclusions. 1. Wave phenomena are fundamental to understanding how signs and stimuli are transmitted throughout the human body. 2. Understanding the physical properties of waves allow for the interpretation of biological processes and the accurate application of diagnostic technologies such as magnetic resonance imaging and ultrasound. 3. Waves are present in multiple everyday clinical contexts, which can be illustrated through dramatizations and real examples for the human body. 4. Medical technologies based on wave phenomena require solid biophysical knowledge to ensure their appropriate, safe, and effective use in patient diagnosis and treatment. 5. Integrating wave physics into medical education promotes technological innovation and enhances scientific understanding of psychological and clinical processes.